and welcome to the Valley. Today, I am your host, Janet Michael. It is Community Health Day. That is the day every single month we jump on a Zoom with someone from Valley Health. They, of course, sponsor this program, and we've learned heart health. We've learned about brain health. We've learned about colon health. We've learned about all of the health for all of the parts of the body. And today we are celebrating a little bit of an anniversary in advance, but we are going to be talking with the team at Valley Health Metabolic and Bariatric program. Dr. Christopher Reed is joining us. He is their medical director and surgeon. Tiffany Summer is with us as well. She is a nurse practitioner, along with Jennifer Adsit. She is their registered dietitian. And Dr. Reed, I want to start with you because I joked with you before we started recording that it is somewhat unusual to have a team for these types of medical procedures. And yet this is what Valley Health has done all along since you opened your doors 20 years ago.
Absolutely. So our program, like you said, it's been around for 20 years. We have a good reputation here in the community and have a good infrastructure for taking care of patients with obesity. When patients come into our program, they get a fairly extensive medical history. We really try to get into everything that this patient is dealing with as regards to their obesity and associated medical conditions. But it's not just about how quickly can we rush them to surgery. We do want to try to make sure that we're choosing the right treatment for the patient. We do offer medical weight loss as well as surgical weight loss. And we try to work through that with the patient to determine what's the right course of treatment for them. Once we kind of make that decision, a lot of time goes into preparing them for surgery. And part of that is preparing them for what life will look like after surgery and how can we help them lose weight in a way that is healthy. So our overall goal is to improve the health. It's not just about the weight loss number. Patients who undergo bariatric surgery are going to have rapid weight loss, but it's important that they're achieving adequate nutrition during that time. So a lot of the pre-op work that goes into surgery, which can take 3 to 6 months and sometimes longer, is really about preparing them to be successful afterwards.
This is one of those treatments, too, where in some ways, what happens afterwards is more important than what happens during, because you don't want someone to go through this process, have the surgery or do whatever the treatment recommendations are, and then go back to their old habits and find themselves in the same position 3 years later, 5 years later.
Absolutely. And what I often tell patients at the first visit is that what I'm going to do in the operating room will help them lose weight for about 6 to 12 months. They will lose weight rapidly. The real effect that you get from the operation is that 6 to 12 months. But all the things that they're going to learn working with our nurse practitioners and dietitians, those are the things that are going to help them maintain that weight loss long term.
I want to bounce over to you for a second, Jennifer, because I feel like diet is the most misunderstood of all of the health problems that people have, because we read so many different things in articles and we see it on the news about this is good for you. And then suddenly this isn't good for you. And everyone talks about moderation, but not really what moderation really means. You play a critical role in this entire process.
Sure. Yeah, absolutely. There's a lot of misinformation out there. People get information from their neighbors, from online. There's a lot of support groups. And while some people are very well-intentioned and certain things may have worked for them, as dietitians, we really focus on evidence-based recommendations. And something that we really emphasize and work with our patients on in the clinic is just working on those lifestyle changes. We're not looking for short-term fixes, like you were saying, because that really does produce short-term weight loss. That's not something that is what the patients are looking for their long-term results. So we work on helping them make sustainable lifestyle changes so that they really can lose the weight.
I would guess that a lot of people assume out of the gate, that means I have to give up all the sweets or I have to give up red meat completely. Rarely is it a situation where you have to completely give up something out of your diet. You just have to know how much of it to eat and how often.
Yeah, and we definitely work with our patients on making the changes with portion control and balance. I think balance is really important so that it is realistic. Every patient is different. So our goals are not going to be the exact same goals in every single appointment. A lot of the time we work on making gradual changes. It's so important to assess what their intake is like and then work on the goal setting together. Rarely do I tell my patients, you need to do X, Y, and Z. I take it from an approach of what are you willing to make changes with? What are you ready to work on? And that really can make the difference too.
Tiffany, being obese can impact so many other parts of your health. So I'm sure you hear a lot of different stories and are dealing with a lot of other things, from diabetes to other health issues that you're also trying to treat within this time frame.
Yeah, it's a lot of getting patients to understand that obesity is an incurable disease. It's a disease that's only been recognized for like the last 5, 6 years. And so looking at it as a different approach and trying to empower them that with it being incurable, the beauty of our comprehensive and our team is that we are here for support. Anybody can get you to surgery, but the reason why we have such a great reputation is our long-term commitment and that follow. Because again, a surgery isn't going to cure it. It's taking that commitment and making those lifestyle changes and empowering them that they're capable, as well as giving them the resources to even modify, to adjust things to their lifestyle. Because we have people that come in with different ethnic backgrounds. We're not going to tell them that they have to eliminate everything that they've ever loved in their life, because again, who wants to do that? But empowering them to make those choices in a positive way and being able to understand and relate with them that there's a lot of misconception around obesity. We always think of obesity as overnourishment, but really the largest aspect of it is that malnourishment, and that's what's driving a lot of obesity. Getting people to understand and being able to work with our dietitians to empower them that they realize that food is actual fuel, and it all plays into a huge part in our ways that we are able to reduce some of those comorbid risks. The beauty about bariatric surgery is I get the benefit of meeting a patient and understanding their biggest concerns. And a lot of them are saying, oh, I really want to prevent developing diabetes. I saw that my mom and my dad, they struggled with this, and I really don't want to do that. Being able to empower them and give them education on all their options, the pathways that we have within our program, that they're not locked into one direction or another, but that you have several options, even ways that we're able to cure things like diabetes or significantly reduce their disease burden. That's the beauty of what we get to do every single day, and it's liberating.
Dr. Reed, it's not always surgery is the first and only option. You have, as Tiffany said, a lot of options at your disposal to work with practically any patient.
Certainly. We do have a medical program. So patients who really aren't interested in surgery at all, we have medications that can help them. Everyone's heard of the GLP-1s, the shots. There's a lot of interest in that right now. And those meds can be great for the right patient with the right education. What I have seen, unfortunately, is a lot of times patients go somewhere else. They get prescribed this medicine and they're told, oh, just take this shot and that'll take care of everything. And they don't get the education they need to be successful. For patients who are interested in surgery, we have full range of surgical capabilities. We do primary operations, we do revision operations, and we've started offering endoscopic options. So if a patient doesn't want to be on a medication for life, they want another option that's short of a surgical procedure. There are procedures we can do with an endoscope where we go down through the esophagus with a camera while the patient's asleep and can sew the stomach from the inside to help make it smaller. Or there are intragastric balloons that can be placed in the stomach that can contribute to weight loss as well. So we have medicine, we have endoscopy, and we have surgical procedures.
Having all of those options at your disposal is also pretty valuable when you have someone who maybe will need surgery at some point, but at this stage, they're not ready for surgery. Maybe they're 300 pounds on the other side of where they need to be. And sometimes surgery isn't your first option at that level.
We regularly have patients who come in and meet with the surgeon, and we identify risk factors that we need to address, whether that's losing some weight before surgery or optimizing some of their other medical conditions to make them a safer candidate for surgery. And those patients will often spend time in our medical program, again, preparing for surgery, working on weight loss prior to surgery. Having those medical options for those patients have been great.
Jennifer, how often have you worked with a patient who adopted whatever dietary changes that you have suggested and then were shocked at A, how much weight they've lost, and B, how much better they felt? I sometimes think people don't equate the two of those either, and they really should.
Right. It's funny because we also have a lot of students coming in, and today is our day for our dietitians on our team that we have our PA student. And we had a similar conversation of patients making that connection and how your food really does impact how you're feeling and how that weight loss also impacts that. So we see that on a weekly basis. It's incredibly rewarding. I know Tiffany had mentioned that earlier. So I've been at the program now for 11 years. You don't always get that in healthcare, that gratitude or that feeling of patients are grateful and you feel very rewarded, but we definitely see that here at the clinic. It's very cool to be part of that and help patients change their lives and see that connection because they have finally had their aha moment of how this all works together. And it's really cool to be part of that.
Let's take a break. When we come back, let's talk a little bit, Dr. Reed, about the process itself and all of the things that come before, during, and after, so that someone listening today who maybe thinks it's one thing will understand exactly what's involved, and maybe they'll make that call instead of thinking they're not eligible or it won't work for them. So can we talk a little bit about that in the next segment?
That sounds great.
We're on the Zooms today for our Community Health Day. We are chatting with Dr. Christopher Reed. He is the medical director and surgeon for Valley Health Metabolic and Bariatric Program. Tiffany Summer is a nurse practitioner. Jennifer Adsit is joining us as well. She is the registered dietitian, all part of the team that work at Valley Health Metabolic and Bariatric Program. We're going to come back and talk more with all of them in just a couple of minutes.
Okay, what are you doing with your kids all summer? I can't do another screen time marathon every time it's too hot outside or I need to work.
Same. That's why I signed mine up for Typewriter Studio camps.
Oh, I've seen that place. In Old Town Winchester. It's cute. Art, right?
Yeah, but way more than that. Confidence, goals, history, culture, with real art educators. And different camps every week. My kids actually grow there.
Wait, what ages?
1st through 8th grade, June through August. Half or full day. And you can even stack with the Discovery Museum.
Okay, that's smart.
Starts at just $180 with sibling discounts, so both of yours can go.
Send me that link.
Already did. It's typewriterstudio.org. Oh, and use code FULLDAY at checkout for 15% off the PM camps.
Don't waste another summer. Have your kid explore, play, create cool art, and build friendships in a safe, creative space with limited class sizes and licensed teachers. Visit typewriterstudio.org and click Summer Camps. Use code FULLDAY at checkout for 15% off the PM camp. Additional savings for members.
Welcome back to the Valley. Today, I am your host, Janet Michael. It is Community Health Day, sponsored every month by Valley Health. Today, we are highlighting the Valley Health Metabolic and Bariatric Program. So we are on the Zooms with Dr. Christopher Reed. He is the medical director and surgeon for the practice. Tiffany Summer is their nurse practitioner. Jennifer Adsit is the registered dietitian. Tiffany, I want to come back to you to ask about someone who calls and makes an appointment and they're not really sure what they need. They don't know if they need surgery. They don't know if they have other options, and they land in your office. What does that look like? How does that conversation go?
It's my favorite kind of conversation because I love that I get to foster a relationship and discuss, again, their medical history and get an idea of what's been driving and contributing to their obesity or struggle. But then I love that I'm able to give them all the options and what I call pathways within our practice, because we've always been thought of as just surgical, and it wasn't understood that we have so many different pathways. And the fact that not only do we have our surgical for bariatric surgery, we also have our heartburn evaluation clinic. We have a very extensive medical program as well as even a comprehensive program. So people who want to look at focusing on just diet management and things like that and no medicine at all for weight loss. So we offer a wide range of items. And I always love to speak with patients and let them know what is available and always present it as a pathway. They have different pathways that they're able to choose because they are the one that is in control of their care. My job is to keep them safe. So I can offer them everything that we have available that is within their safety. A lot of times when I meet people and they're coming in, they had no idea what bariatric surgery was or that they were even a candidate. I always tell them, I myself am not a surgeon, but I have 3 wonderful surgeons who are wonderful educators that I would love to get them in with. Meeting with them and having an initial consult never means that you are locked in for surgery. But if you are going to make a major decision about your health in your future, I would want to know that I have all the information to make that proper decision. And so meeting with them is a way to gather more information and to be able to be well informed. A lot of times too, they're interested in medications, but they weren't given education that there's a multitude of different levels of medications, whether it be injectable or oral as well. Even touching base on the comprehensive side, which is leaning more towards Jen's realm of very closely followed dietary recommendations and assistance. I always love the ones that come in because I get to share, and sometimes my joy bubbles over of all the beautiful things that we get to offer because, again, education is power.
Dr. Reed, if surgery is the option or the best path forward for a patient, What does that look like? Are there prep things that have to be done before? How long do you see a patient after surgery is over? Give me a little bit of an overview of what that pathway looks like.
Just to touch on the first part of the question, for patients who are appropriate candidates for surgery, there have been numerous studies that show that surgery has the best and most durable weight loss. And I think that is one thing that is getting lost a little bit in the GLP conversation. These meds are great, but they are a lifelong medicine. That's one of those things that doesn't get addressed a lot. It is not a 6-month quick fix. Patients who take the medicine for 6 months or a year or however long, but then stop it, the literature shows, the industry funded studies show that the patients regain weight. So just to touch on that a little bit, surgery has been shown to have higher weight loss, better resolution of medical issues, and be more durable than some of the medications. So oftentimes, if a patient is a candidate for surgery, surgery is probably their best option. Now, what makes someone a candidate for surgery? That's what that initial consult with a surgeon really is about. I sit down and I go through their entire medical history, their surgical history. We review what medications they're taking, and we talk about how surgery can impact all of those things, not just weight loss. As a center of excellence with it's called the MBSA QUIP, the Metabolic and Bariatric Surgery Accreditation and Quality Improvement Project, long phrase.
I would say that's a mouthful.
we are an accredited comprehensive center. So all of our patients are included in the databases that generate the calculators that we use in the office. So when a patient comes in and has that first consult, I'm going to talk to them about all their surgical options. And then we have a risk calculator that I can put that patient's information, their age, their gender, their height, their weight, their medical comorbidities, if they've ever had surgery on their stomach before, all of these things go into the calculator, and I can provide them with a personalized risk assessment. So I can tell them that based on our database of all centers of excellence across the country, this is what we predict their risk of surgery is in terms of 30-day complications, as well as how much weight loss we think they will lose within the first year and how likely they are to resolve their medical issues. That really plays into which operation we choose for that patient. A patient with diabetes and heartburn will probably get a better outcome with a gastric bypass, whereas other patients, maybe a sleeve gastrectomy would be better and lower complications. So it's not one size fits all. It is trying to tailor the operation to the patient. Once we've had that conversation, they begin meeting with our dietitians. They will work with the nurse practitioners. Again, as I said earlier, it's a lot of pre-op education, preparing them for life after surgery. How long that takes can vary depending on the insurance. Some insurances require a minimum 3 months or 6 months or 12 visits. So we will figure all of that and make that very clear to the patient at the initial consult of what this is going to require. Now, those are guidelines. If a patient needs more time before we all feel that they are safe to proceed with surgery, we will make sure that the patient and we are all comfortable before they go forward. There's also a behavioral health evaluation. Most of our patients do that as a telehealth visit with a group that specializes in preoperative evaluation for bariatric surgical patients. That is their entire practice. If they're already seeing a behavioral health provider, we can get a statement of stability from them. But there is as you touched on earlier, there are other things that go into this, and behavioral health is one of them. So we make sure that we're addressing all of that. If the patient has any high-risk medical issues, cardiac disease, things that they need further evaluation, we'll coordinate those referrals as well. And then once they have gone through that process, we give them a checklist at the first visit that tells them all the things that they're going to need to do before they're ready for surgery. And each time they come in, we update that checklist. Once that checklist is completed, they will meet with the surgeon again. I sit down, I go through all the results of all the tests they've had in the last several months, and we make sure that nothing came up in those tests that might change my recommendation. Or maybe they're having second thoughts or have developed questions that they didn't think about at the first visit. So we address all of that. And from there, we're ready to proceed to surgery. So we get the insurance authorization, schedule them for surgery, and then everything really begins. Right.
Ironically enough, that's the actual beginning.
Correct. So there's a lot of buildup, but surgery is kind of a new start. I've had patients schedule surgery on their birthday because they said it's the new start. I'm starting a new life as of this day. And that's a decent approach for patients to take. We want them to start it a little bit before, but that mentality is helpful. They then come back into the office within a week of their operation just to do a routine post-op check. They go through a diet advancement. We do start them on a liquid diet for the first week and then slowly advance that throughout the first month. Then we see them back at a month, 3 months, 6 months, and then we see them annually. So once you're a patient in our program, we will see you for life. We want to monitor vitamins, right? We talked about this is rapid weight loss. We're altering anatomy. Patients need to take vitamins. And as long as you are having follow-up and we're screening for these things and you're taking the appropriate vitamins, very easy to manage. But when patients don't get these labs checked and quit taking their vitamins, you can get into some serious vitamin deficiencies that can have other effects. So we will see these patients back for life.
I would imagine when those visits happen, they come in so excited to be able to show off how much better they feel, how much better they look, how much they've told friends and family about, hey, you've really got to cut out some of this sweets, and how they're now probably your biggest cheerleaders, not even just, Jen, for a good diet, but for everything.
The 6-month visit is my favorite visit. The 6-month post-op visit, by far my favorite visit of all, because they've started to notice the weight loss themselves. Usually other people see it first, and it can take a few months before the patient really starts to recognize it on themselves. Consistently, patients tell me that while they came in for the weight loss, that's not the thing that they're most excited about at 6 months. It is having more energy and keeping up with their kids, taking less medicine, simple things to some of us that to these patients is a huge deal, bending over to tie their shoes without feeling short of breath. These are all lifestyle things that many of us may take for granted, that when patients come in at 6 months, these are the things that they say, this is why I told my friend that they need to come see you. It's often not the weight loss itself so much as it is the impact on their quality of life.
I know I always like to emphasize in my visits because, again, I get to see them after they've met with a surgeon and I get them to start them off for their initial diet. I always jokingly say, I'm preparing you to be stuck with me for the rest of your life, because our goal in the beginning, our goal in this entire journey is always improving their health and reaching their goals, but it's always going to be safety at the end of the day. And that's why we do all of these screenings and things of that nature, because again, their safety is our utmost importance. A lot of people come in, they may be gung-ho and they're like, oh no, I want surgery, I want it now. And we have to slow them down. And that's sometimes hard because I'm like, we have to teach you because this is a huge decision. Sometimes we have also had to bend the bearer of bad news because again, safety is our main priority and surgery is not always the best option for an individual. That's where, again, I always like to preface that we have those pathways. You're not locked in or limited in one, or you might start in one pathway and jump to another, and that's okay.
Jen, a key piece of this entire journey, both before and after, is the lifestyle change you mentioned earlier, their diet. And I would imagine that they learn so many things that they didn't even realize were important. You're teaching them a lot of different things, not just about what they're eating, but when they're eating it, how they're eating it, and why they're eating it.
Absolutely. So each patient, we focus on an individualized approach. So for patients who have schedules that impact their eating habits, whether they're working night shift, maybe they're a truck driver on the road and they're traveling, maybe it's a teacher with just a busy day, a busy schedule. We work with our patients, we assess what their intake is, and then we help them learn how to make changes to fit that. So maybe if they are traveling, we work on, these are some healthy choices. This is how to modify and work on portion control to make it work. Or do we focus on the eating schedule? There's really different types of patients. Some patients come in and they have been dieting their entire lives. They have lost weight. They have gained it back. It's not their first rodeo. And so that's a situation where knowing what to do is different than being consistent with it. And we really help with maintaining those lifestyle changes. And there are patients who really, we need to start from the basics and go through, this is how you read a food label. This is how you count up your grams of protein that your body needs. It can be as basic as going through, let's start your day with a healthy breakfast. And these are some healthy choices. Although I usually try to word it, what are things that you like? Because everyone has their own preferences. Eating habits are hard to change because we have been doing it our entire lives and we have control over it most of the time. So it can take a lot of education and a lot of appointments to really help patients have that moment of, okay, I can do this and it's starting to work, and they really have to buy into it to be able to commit to it. And
I
just like
think,
Tiffany
too,
was saying too, it's so important, not only just for surgical, but really with the medical weight loss and the medication, it's not just the success of it, it's the safety. So as they're losing weight, especially significant amounts of weight, we really have to make sure that they are eating to fuel their bodies for energy and also getting enough protein and vitamins and minerals and fiber, that they do have a healthy and safe outcome with it.
Dr. Reed mentioned a second ago how his favorite visit is a 6-month visit. And it's not because people come in and say, hey, look how much weight I've lost. I would imagine for you, it's also a mom, for example, who now is taking what she's learned about portion control, about healthy eating, and that's what she's feeding her family. So you have, in effect, potentially prevented some sort of illnesses down the road because she's taking care of what she's feeding her family and maybe not allowing those kinds of bad habits to even develop.
Absolutely. Yeah, it's life-changing, not just for the patients, but for family members. And eating is so connected to so much of what we do in our lives, and how that all fits together is really cool to see.
So, Dr. Reed, tell me about this big celebration. You're celebrating 20 years, June 10th. You're going to have a big to-do. Give me some details for it.
Like you said, June 10th, it's here on the hospital campus at the conference center, and it is open to all past, current, and potential future patients, as well as providers in the community. Big thing is it's 20 years of impacting our community through weight loss. So wanted to give a chance for patients to come out and spend some time with the surgeons, the office staff. Again, we see these patients for life. They get to know us, get to know our staff, get to know the whole team. Just a chance for everyone to get together at the conference center. Jennifer has been working with some of the vitamin manufacturers. We have some gift baskets from them, some memberships to the wellness center. So some things to give away through a raffle. Again, any of our past patients who are listening, current patients who are listening, or anyone who just wants to learn a little bit more about the program, June 10th at the conference center.
I feel like that's a great low barrier way to just come and scope out if what they're hearing today has some interest to them. They're able to come in without maybe the pressure of an appointment or any of that sort of thing. It just makes it easier for them to just come and talk, have a conversation.
Certainly. And hopefully there'll be plenty of former patients that they can talk to. Most of our patients are very happy to share their stories. With that, I'll also give a little plug for our support group, if Jennifer wants to talk about that a little bit more.
Yeah, sure. So we do offer a free support group, and we have really great topics. We actually just had one today about why muscle mass matters. We get guest speakers to come in, really great things that we cover throughout the year. We also offer a gift card giveaway with that too for an incentive to come. We have the schedule for that posted on our program Facebook page, and we offer virtual and in-person support groups.
So you guys have a Facebook page that people can follow along?
Yes, it's the Valley Health Metabolic and Bariatric program. And information about the 20th anniversary celebration is on there as well. So if patients or anyone wants to go there, get more information, and there's a way to RSVP from that post.
Do you have a specific page on the Valley Health website where people can go to just learn more about the practice in general?
We do. And so if you go to the valleyhealthlink.com, you can go to our services and find the Metabolic and Bariatric program.
And I wanted to touch base on something because I love what you said earlier about being able to teach, like a mother teaching their children. And I know we talked a lot about within this program, it seemed like it was really focused on just adults, but we also offer a very comprehensive adolescent program that starts at age 14, because you're talking about people who have coming in and they have comorbid conditions that have caused a lot of health complications. Not only are we able to impact those lives and families and prevent some of those health disparities and things of that nature too, but when we are able to get individuals started in an adolescent program, we're also really supporting and fostering that we are working on preventing some of these disease processes. And the way that we do that is education. So we aren't just focused on just adult health. We see ages 14 and up as well.
Awesome. Tiffany, thank you for all this great information. I appreciate it. And Jen, I appreciate your insight today as well. Thank you for taking some time. Dr. Reed, thank you for giving me so much great information. I thought I knew it all, and it turns out, once again, no, I do not.
Well, thank you for having us.
I will be back tomorrow with a brand new episode of The Valley Today, just a few minutes after noon, so meet me here then.